Hello everyone, my name is Ting Wang. Today I will present my project title, Community Health Enhancement Through Social Determinants of Health Assessment and Communication Strategies. This project was completed during my time at Live Health Smart, Alabama, under the supervision of Dr. Nou. First, I will talk about the scope of work at Live Health Smart, Alabama. Our mission is to reduce obesity, lower high blood pressure, manage diabetes, and decrease high cholesterol. We offer health education programs, distribute nutrition foods, provide free health screenings, and promote physical activities in the community. This is the project name. So my project focuses on assessing the social determinants of health and creating communication strategies to improve health outcomes. The goal was to conduct a comprehensive assessment of SDOH, collaborate with stakeholders, and implement evidence-based interventions. We also monitor and evaluate the outcomes and share our findings with the community. Here are my specific contributions to the project. I coordinate data collection, make sure that the data was accurately entered and managed. I developed communication materials that were culturally appropriate, which help engage different populations. I also organized community events and build relationships with local stakeholders to increase participation. The project focuses on addressing social determinants of health within communities by using data-driven approaches and tailoring communication strategies. We aim to empower community members by using culturally competent methods and ultimately improving overall health outcomes. As part of the project, I worked on fundamental competency, MPH 7, which involves assessing population needs and evaluating community assets. I distributed SDOH surveys and collect data from community members, ensuring that the data was comprehensive and accurate. I also focused on MPH 3, where I analyzed both quantitative and qualitative data using biostatistics and informatics. This involved analyzing the survey results and using software tools to extract meaningful insights that inform our decision-making processes. So the study titled Assessing Social Determinants of Health and Healthcare Utilization Among Patients at the Live Health Smart Alabama Mobile Wellness Clinic. It's a cross-sectional study that looks at the impact of SDOH on healthcare access in Alabama. The goal was to understand how these determinants affect healthcare utilization to improve mobile health services for underserved populations. The study was conducted between May and July using the prepared social determinants of health instrument and healthcare utilization instrument. We surveyed adult patients at the Live Health Smart Alabama Mobile Wellness Clinic, ensuring that participants were not repeated, and we entered the anonymized data into a secure database for analysis. Here you can see the demographic characteristics of the participants. 24% were female and 76% were female. In terms of race and ethnicity, 84% were Black or African American, and 87% were non-Hispanic. This slide shows some key social determinants of health. 38% of the participants were employed and 31% were unemployed. Income levels varied, with 23% earning less than 10,000 annually. Additionally, 68% report have enough income to meet their basic needs, but 32% were concerned about running out of food. Regarding healthcare utilization, 93% of participants had insurance and 83% had regular medical checkup. However, only 20% had undergone a colonoscopy, which indicates a gap in preventive care. And 74% of participants had access to fresh fruits and vegetables, and 50% engaged in at least 150 minutes of moderate intensity activity weekly. These figures highlight the availability of resources and physical activities levels within the community. The results show that low income and unemployment are linked to lower healthcare access, while there is high insurance coverage. There are still gaps in preventive care utilization, especially in services like colonoscopies. These findings suggest that Live Health's Smart Alabama mobile clinics are effective in reaching underserved populations, but more work is needed to address gaps in preventive care and support for unemployed patients. Future efforts should focus on enhancing community resources and tailoring services to meet the specific needs identified in the study. So in conclusion, social determinants of health significantly impact healthcare utilization among Live Health Smart Alabama Clinic patients. It is important to continue refining our outreach and services to reduce health disparities. I'd like to thank Live Health Smart Alabama and Dr. Nou for their support throughout this project. So in this part of the project, I focus on MPH 18, which is about selecting appropriate communication strategies for different audiences. I developed educational content focused on nutrition and physical activity. I researched current guidelines and created tailored fact sheets to communicate important health information effectively. I also work on MPH 20, which emphasizes cultural competency in communication. I ensured that the fact sheets were culturally relevant and promoted services like the mobile market and mobile wellness clinic. The material were designed to encourage physical activity and healthy eating within the community. Here you can see the titles of some of the educational material I developed: Healthy Fat, Glycemic Index in Diabetes, and Health Risks of health high salt intake. I follow a process that included researching guidelines, developing content, and ensuring cultural relevance between finalizing and distributing the materials. For MPH 19, I focus on communicating effectively with non-academic audiences. I use clear and accessible language in the fact sheets, conduct nutrition interviews and organized lunch and learn sessions. The goal was to develop public health resources that provided practical tips and advice on health living. During the project, I engaged with participants by explaining nutrition topics and providing healthy eating tips. I discussed the benefits of a balanced diet, highlight the importance of regular exercise, and share strategies for healthy meal planning. These interactions were essential for reinforcing the educational content. In summary, the project achieved key deliverables that have positively impact community health. I would like to acknowledge the support of Live Health Smart Alabama and express my appreciation to my preceptor, Dr. Nou, for his guidance throughout this experience. Finally, I want to thank everyone who supported this project, including the community members who participate in the surveys and events. Their involvement was crucial to the success of this initiative. Thank you all for your attention today.